Hello, everyone. If you would slowly settle down, find your place, welcome. Um, I'm glad to see you here all so in big numbers. My name is Vincent. I'm glad you're all here, and I just want to introduce to you our speaker of today. His name is Gregor Hasler. He's a full professor of psychiatry and psychotherapy at the University of Fribourg here in Switzerland. He works as a psychotherapist and also leads the research group at the university in psychiatric research. There, we, as I am part of that team, do research on mostly at the moment on LSD and its effects on neuroplasticity, but in the past he has done various research on depression, stress, and other mental disorders. Besides that, he is a published author for several scientific publications that you can all read if you want to. One about it, also about psychedelics, called Higher Self, Psychedelics and Psychotherapy. So far only available in German, but soon to be published in English as well for those of you who don't speak German yet. And yeah, we're really glad to have him here today, and he's going to give a talk about psychedelics and psychotherapy. Give all a warm welcome to Gregor Hasler.
Thank you, Vincent, for this nice introduction. Thank you for coming here. It's very interesting. I mean, many years ago, I studied medicine here close by, and sometimes I came over here for philosophy because I had a friend who studied philosophy. And then I went close to here to a Platon seminar, and amazing was it was very old people. And today it's different. So let's say psychedelic philosophy, then everything is changed. That's great, because we need young people who want to do innovation, etc. And I think that's a field of innovation. So today I really talk about psychotherapy and the experience we can do in Switzerland. That's unique, as you may know, that we can treat patients outside of studies. That's a big difference. In studies, you have to select people and then really force them into certain schedules. And in treatment, you're completely free. You just can work for the patient. And also work in psychiatry, but more and more I work also in a neurological hospital to treat patients with stroke and other really severe neurological conditions. Just you see, the experience I have is based on this program, Exceptional Medical Use Program. It's like a hole in the Swiss law that we use. We circumvent Swissmedic, which is a big deal because everything through Swissmedic is extremely complicated. And you see in this program, we started with LSD and MDMA. That's why so many people, as I myself, have a lot of experience with LSD, because in the beginning it was only LSD, MDMA. And since, I think, 2 years, we have psilocybin, which is now the most widely used substance. You think about 5 years ago, we may have 50 new cases in this program, and now we have 730 in the last year. So it's really amazing how many people are now treated with psychedelics in Switzerland. And you see there's no really accidents or so on I'm not aware of. Just that you understand a bit the program. So if someone wants to have the treatment, then they have to be a patient with a severe mental disorder, and then we check if he is suitable for this program, means having a severe uncurable disease and being treatment resistant, and then we can apply to the BAG, the Federal Office of Public Health in Switzerland, and if they agree, that's always for one substance for 1 year, we can start with preparation sessions where we explain where it is and with food and clothing and all these details, and the mental preparation, explaining the treatment, and then we have the drug day or substance day. We more and more say substance day, about 10 hours, can be in the group. In Fribourg, I do it myself, being with the patient for many hours. And after this, we have integration sessions. We call that all a cycle. And in the ideal case, you're the psychotherapist for the patient in the long run. Then you have more sessions. And if necessary, you do another cycle. Certainly more and more, I have so many applications, so many people who want to do psychedelics. So I just do the cycle, but speak with a psychotherapist. There's always some psychotherapy in the background. Patient goes back and has the psychotherapy with their usual psychotherapist. Certainly there's a big potential in psychiatry. It's a new treatment mechanism. You know, we have many new substances, but the mechanisms of action are quite old. I'm not sure if you know the history of psychopharmacology. It's a very Swiss thing. And it's all in 5 years. I think from 45 to 55, all the major classes were discovered. Imipramine in Kreuzlingen in Switzerland, Ritalin in Basel, benzodiazepines in Basel, clozapine in Bern. So more than 50% of all discoveries in Switzerland. And then there was new substances, always with the same mechanisms. You know, the major mechanism is kind of modifying the monoamine system. Monoamines are serotonin and catecholamines, and catecholamines you have dopamine and noradrenaline. It's a very small system in the brain. It's amazing. The major systems are the glutamate and the GABA systems. So it modulates these rather small systems. You know, lithium is very different. Benzodiazepines are different. They work on the GABA system. Now we have ketamine, small dose of ketamine, works on the glutamate system. And with psychedelics, we're still working on the serotonin system, but in a different way. So we have minor side effects. It's very popular with patients. That's also important. We have, for example, some treatments for trauma victims, CBT, so behavioral treatment, but people don't like it. It's not pleasant. And so up to 90%, for example, if war veterans in the United States reject this kind of treatment. So that's a big problem. So we have to have effective treatments, but also acceptable treatments in psychiatry. Certainly in Switzerland, it's an option for therapy resistance, we call that. So they are not responding to psychotherapy and various substances. And then we kind of can add these to the psychotherapy or add these to the psychoactive or pharmacotherapy. And certainly it provides new insight into mental disorders. It's very interesting for me as a clinician to see the disorder or to understand the disorder using psychedelics. So I don't take it, so the patients take it. There are limitations. It's not for everyone. I'm going to show you that's a big problem. We have to select. So there are many people who want that, and finally we select some, and that's kind of unethical, or that's different from benzodiazepines. Everyone, if you give you Valium, almost everyone would tolerate it and be very quiet, maybe sleepy, but that's not the case here. If I would take LSD and would give everyone LSD, the reactions would be very diverse and unpredictable, and some of you would have to go to the emergency. That's a big problem. Then potentially high placebo effect. I can show you, maybe there's studies where they use, for example, a medium dose of psilocybin, 10 milligram, and the high dose, 25 milligrams. That's the best to control for the placebo effect. That's an important study. And then if you're naive to psychedelics, you would not understand that 10 milligram is not the full dose, and you see only the full dose has antidepressant properties, not the 10 milligrams. So the best we have. But certainly there is a placebo effect because it's hard to blind. But you must see it's other things are also hard to blind, like blinding psychotherapy is not possible, blinding physical therapy is not possible. We have knew that the drugs are really safe, even in people with heart disease or with stroke, what I'm starting to treat. It's very safe, it's amazingly safe, but we have non-pharmacological safety issues. For example, they are not prepared, they would be overwhelmed, or they get abused in some studies, even in official studies by MAPS, you see abuse in the treatment because there's still a person vulnerable for so many hours, and that can be abused. And so it means for the institutions, it's also an investment into safety in their hospitals. And certainly, it's usually combination. You give the substance, you do psychotherapy, and we don't really understand. I will tell you what kind of psychotherapy we do, but there's not a lot of research on this kind of psychotherapy because it's a new way of doing psychotherapy. So usually that's not required by the FDA or the Swiss Medic. They just want to see efficacy data, but here they tell now more they really want to understand the treatment. So here you see why it's not for everyone. Certainly you have to have a good working relationship, like a mountain guide with a client, and that's a major obstacle because you can imagine in psychiatry you have a lot of patients who are not the ideal client for mountaineering, or the people with personality disorder. It's exactly the problem, having a good working relationship. All these people now are kind of excluded. Then people with a psychotic episode in the past, also with schizophrenia in the family, with bipolar disorder. So that excludes still in Switzerland up to 15% having any kind of genetic background of schizophrenia. Because in the 60s, when they had these severe flashbacks or persistent perceptual disorder, all these heavy cases, they found out they all kind of related to having a risk of schizophrenia, and so we exclude them. So now that's way safer, but it's also an ethical problem to do that. No epilepsy, certainly a good understanding of the therapy. That's certainly a problem. If we do the treatment like in Fribourg, the people come and they read my book, everything is no problem. But if you go to the hospital, maybe you talk to the patient has never heard about the word psychedelic, so it needs a lot of time to explain. Because if you take it psychedelic, you're not prepared, it's always a bad trip. So the preparation is really important, and then you have to check if the patient really understands what is he or she is facing. Then certainly all these patients have medication. In the neurology clinic, there are usually 20 substances. Here in psychiatry, maybe 5 substances. But then you really have to understand how the psychedelic may interact, and you have to do a treatment optimization to get to the point that you can treat. So you need a lot of medical doctors to do that. And certainly in Switzerland, it's therapy resistance is a requirement for this program that I described. Here you see how dramatic this is. I mean, I always look in the studies, you see above how many people, do you see my cursor? Yeah, see that? 1,000 people screened. You know, it's extremely costly to screen 1,000 people, and in the end, they treat 59. And it's certainly not the wish of the company to do that. I must say this company, for example, Compass told me that may even move out or need way more money because of these problems. So they screen 1,000, treat 59. It's also not a good business model if you have to do so much screening that may not be really paid, and then finally you can treat 59 patients. Certainly we have to understand that. You see, there's also people who finally decline to participate, for example, and certainly we don't understand why these people here in the studies, only people interested in psychedelics with the depression, why they do not meet inclusion criteria, because these inclusion criteria is not extreme. So that's a really, I think, a major challenge. The other challenge is certainly you need some rooms. That's also cost in the hospital. We have installed these rooms, and that's paid by the hospital, I must say, and the university. That you have a good environment, you know, we say them living stool atmosphere, and I think it's really important to have that and not a wide or very empty room, because it's still the atmosphere is important for having a good trip, for this relaxation I will show you soon is very important. So they can here sit, you see this flower. It's a bit inspired, you know, by the French speakers. They have more like romantic ideas. It's a flower stool. It's really crazy. It's also extremely expensive, but they pay that. And I don't know, Fribourg, you would think cheese, or I don't know why they're so into psychedelics. And here you see they could lie or sit or whatever, but usually they like to lie in bed. Even if MDMA, which is an amphetamine, it's amazing. Here people are not like in a party mood, but really lie down in the bed with the amphetamine. It's amazing. The most important thing is really these eye shades. I have a whole collection for my patients because they can easily be distracted. And you can imagine if you think, wow, this bottle of Coke looks so great, and you look for hours, how amazing this color, then at the end is no treatment because you don't really deal with the problem you should solve. And so it's very important to have a focus, to remind the patient, and to have these eye shades so he or she really looks inward. So that I think is extremely important. The other is music. We don't play all the time music, but a third of the time, some very slow music to enhance a bit the emotionality of the trip. What I said, there is now extra pharmacological safety guidelines, and we're working on this. So there are problems like, for example, touch, because some people, usually we don't touch patients in psychiatry, I must say, but in this psychedelic field, there are a lot of body therapists. And so here it's very complex because the patient is in a very special state and may not respond adequately. And so it's very important to talk in the beginning if there should be touch or no touch and how the touch is done. So I usually don't touch my patients, but I understand. I mean, there is a study that touch may be beneficial, I must say. Although the touch is very different when you get MDMA as not. There are some people having problem with touch in their lives, so touching may be like an exercise under MDMA. I don't say anything about body therapy, but it's just all the abuse we see is a bit related to this idea to combine psychedelics with body therapy. The other is the co-sitting. I just telling you a little bit about abuse because it's really an important thing, because if you have abuse, it will be the end of the story. So we have to prevent abuse. And the abuser is a lot the co-sitter. Maybe she's a psychiatrist and she thinks she's a nice guy, but then he turns out to be an abuser. So that was in many cases like this. And so it's very important that they are both licensed, we see. If they're both licensed, that's really a safety thing. And it's also important that they also work together from the beginning. I don't do that because I don't have the money to pay someone to be around all the time, but it's not a good idea to have a co-sitter just for the session, but the co-sitter should know the patient from the beginning. So it's good if you are a couple and the couple is doing always all the whole treatment, so preparation, substance, and integration. There's also new kind of side effects. I mean, in the old days, they said there's no side effect, but all the effects are positive. So Timothy Leary says all is karma, all is spiritual, all is good. But that's not the case. Some people have side effects, and they suffer from side effects, and even some have lasting side effects. So we really have to assess side effects. Certainly, it's a bit different. For example, here usually headache and nausea. Vomiting is rare with these three substances, but that's the most frequent. It's not a big deal. You could give a medication, and usually it's short-lived, so it goes away. But for example, here, muscle shaking, some people would say, no, I had a muscle shaking, but it was not a side effect. It was good. It was beneficial. And so that's a new thing. Is it during the substance, after the substance, and how is the impact on patients' life? Certainly in exposure therapy, for example, if you have spider phobia, you're exposed to spider, then you also have negative feelings. You know, in psychotherapy, we're used to bringing people into negative emotions. That's not in itself a bad thing, but certainly you have to be sure that the patient thinks that or feels that this was beneficial for him or her. But it's true, even if you have a very challenging trips after months or weeks, usually people see it more positive. I show you also why I think that is. Then certainly substance and dose. It's also important that a substance for psychotherapy should induce emotional psychological processing. It should induce positive emotions. We have study on that. So if it's just negative, it's not a good thing. Sense of control must be there. So it's not the idea to completely have a complete ego dissolution. I mean, in the beginning, I did that, give a very high dose of LSD, but I mean, patient was lying there, and at the end, he said, yeah, I don't know what happened today, but it was like meaningless, and psychotherapy was not better. So I really felt that you have to go down with the dose to have really an interaction with the patient, and the patient has still some control over his experiences, and you can still guide a bit the trip, so that's really of a therapeutic benefit. And very important, patients should be relaxed. So I always ask is to relax, should be relaxed. It's really amazing, even if you have the very strange experiences, they say father dying or something, when you ask them, are you relaxed? They say, I'm completely relaxed. I think that's really an important issue, that is this relaxing quality of psychedelics. Then you see the doses, maybe not important, but you see here that's a study by Abigail Calder, one of my PhD students. She analyzed the data of my treatments, that's real treatments, and you see here MADRS, how much the depression severity went down and how much they were relaxed, and you see a clear relationship. The more they're relaxed, the more it's beneficial to reduce depressive symptoms. You see also here a study from Basel, from the Matthias Lichty lab, and that's a very interesting study for different doses. You know, we don't call that dose-finding studies in pharmacology, clinical pharmacology. And you see 100 LSD, 200, and you see here the positive effect did not increase from 100 to 200, but the negative effect did. And since we know that negative effects are negative for treatment, or rather negative, or let's say differently, positive effects are really important. So you can see here also, like, or you have a scientific evidence that it's better to give 100 than 200 on average. Certainly, if 100 is not enough, you can still increase the dose, but that's a bit our experience. Okay, now I go a bit to the mechanism of the treatment. You see, we still have like a pathophysiology of depression. Exactly, we know that maybe the serotonergic system may have a dysfunction. We know the catecholaminergic system has dysfunction. We know that is clearly related to stress symptoms. That is rather related to reward symptoms like anhedonia or addiction. And you see there are other like sleep abnormalities. We would say impaired learning and memory. Now we would say impaired neuroplasticity. So the big three, let's say, neuroplasticity, learning is reduced. Then we have anhedonia, or in addiction, also a severe dysfunction of the reward system, and you have a sensitive stress system. Certainly, psychedelics may introduce a completely new mechanism. Certainly one theory, it's still a theory, but it's an interesting theory, is called the relaxed beliefs under psychedelics. So in a psychedelic state, there is less emphasis placed on prior beliefs and more on incoming sensory inputs. These may be important therapeutic mechanisms, since psychiatric conditions are often associated with overly strong and inflexible beliefs about the self and the world. You can certainly see that, as I said, with this water, for example, the patient, I mean, if I drink the water, I would do it, I don't feel a lot, because I have so strong expectation of it is water, so it's a bit cold, that's maybe amazing. But otherwise, I don't feel a lot about this water. But under psychedelics, people say, wow, this water is amazing. They would be an hour with the water. And why is that? That's because, or the theory would say, because you don't have expectation about water, and because you don't have expectation, everything is unexpected, and so it's really interesting. It's also Aldous Huxley famously looked at his trousers over hours. You know, he was an art historian, he had all the images or pictures that I liked, but finally didn't even look at them, just at the trouser, because the trouser was so interesting. And I think one of the reasons of this phenomenon is that you have this decreased expectation. And that is really true, that patients have more fixed expectation about the world than non-patients. For example, that everything, all relationships will turn out bad, or these kind of predictions, and that makes certainly life then difficult. The other is neuroplasticity. We also know that from when you stress animal, you see that the dendrites of the neurons go down, you see the spines go down, so you don't have really that a decrease in neurons, like you have in dementia, in stress-related disorder, it's rather that these dendrites get reduced or simplified, and you get more or less spine, so the whole neural networks gets a bit simplified. And you see here, as a vehicle means or no substance, only water and salt. And here added to the vehicle is ketamine or LSD. And you see in these animal studies, cellular studies, you see you have more dendrites. And if you look right now, you would see you have more spines. So these networks get more complex. Certainly, we don't know if this is really important. We also don't know how long will this effect last, but that's certainly something we studying in Fribourg. We kind of measure in humans these dendrites, but indirectly we can measure neuroplasticity with measures of neurophysiology, for example, EEG and etc. And also here, it's one of our highly cited papers on these temporal dynamics. They're really important because it seems you have like a window, you have different mechanisms of neuroplasticity, and you have a window how it kicks in and when it stops. And certainly if you want to combine it with psychotherapy or with any psychological intervention, you have to know this. For example, if they are more sensitive to positive things, you would do here an increase in behavior, so behavioral activation, we call that. And that's what I did over years. I gave ketamine and did behavioral activation, and that enhanced the effect of ketamine. You see here also a bit the problem. If you increase neuroplasticity, you have to think, why is neuroplasticity there or not different? I mean, in the evolution, certainly there's an optimum of neuroplasticity. You shouldn't learn too fast and not too slow. And certainly you see, if you increase neuroplasticity, people are like more sensitive, and that's a positive thing if the environment is positive. But if the environment is negative, that's why under stress there's a downregulation of neuroplasticity. It's a negative thing because we would learn overly of negative events. That's so important that people are after the psychedelic treatment in a positive environment, so that you have to check. And usually if they're in a crisis, financial crisis or family crisis, I usually don't treat them with psychedelics, but I wait because I think in these weeks to come, it's important that people are in a positive environment. So we also write a chapter, I don't know, it's already published. Vincent is on board, psychedelic trauma. I mean, that's based on these bronchi. It's interesting, bronchi is a researcher, he never thought about psychedelics, but he said about why he's, at that time he talked about plasticity blocker, because many of our substances are rather blocking neuroplasticity and are beneficial. So he thought, like, theoretically, what does it mean to increase or decrease neuroplasticity? Okay, so I wrote the book. You see that, Higher Self, and there I try to explain why psychedelics are helpful. I must say there are many effects I'm describing because I don't think there's one effect. Usually in these books, you read popular books about psychedelics, it's usually one effect. It's a trauma effect, that under psychedelics you have this catharsis, and that would be the effect. I don't go into detail, but there are many problems with this theory. But there's a little bit truth to it. Certainly you cannot say the more catharsis, in my view, or in my data, the better the treatment. It's rather they have control and they face. Certainly they have to be exposed to difficult circumstances. That's general rule in psychotherapy. If you have psychotherapy always positive, it's not working. You have to kind of get to difficult experiences. And psychedelics help with that. But there's also other different kind of time perception that goes more into things like narration, memory, seeing your own history, also archetypes. It's rather related to psychodynamic psychotherapy, I would say. Then positive effect, that's very clear. The more positive the trip, it's tricky. It must be positive, but dealing with negative content, that's the best. And then you have to ask why we need this positivity. But usually if you learn something, it's better you relax and you're positive. It's also meaning-making substance, also social connections increase. That's very interesting when I treat these patients with the neurological conditions. That's extremely interesting because they're completely psychedelic naive. The best for me are they never heard the word psychedelics, so they never knew that this is. They have no idea about psychedelics, and then you give the psychedelics. It's amazing what they are talking about. They use completely different words. Recently, a patient told me, you know, the whole world is refined. I thought it's very interesting, refined, because one thing is it's more detailed, but also more filtered. But it's very interesting how they see the trip. And it's very odd, they don't use the Huxley or Hoffman word, they use very different words from their culture. And certainly in these neurological patients, also in the United States, there are people doing these kind of treatments in neurological patients. There it's amazing, they're not so isolated like our psychiatric patients. Usually they're with the family's around in the psychedelic treatment sometimes, and they all tell me day after they're more social, they're more interacting with the family, even if they had a stroke. So this seems to be a very important effect, or a very specific effect. I don't think you see that with other psychotropic medication. There's certainly ego dissolution, etc. So certainly this experience is an important thing. We call it direct experience, that people don't talk about, for example, that their mother died, but they really experience it, some kind of, what would you say? I mean, it's a more vivid, more bodily experience. And we know from Freud and Jung, but also from behavioral treatment, that's important for behavioral change. You have not just to talk about something, like I'm talking to you, but you have to kind of experience it. Otherwise, it has, also in meditation is finally one of the mechanisms, I think, that you really experience something and not just think about something. Certainly, if you think the state, how would you compare the state? I mean, it has been compared to psychosis. Even in Zurich, that whole psychedelic psychosis program, they thought they would understand psychosis with psychedelics. But I must say, the state of psychosis is still very different. You know, here you have like a travel. In psychosis, really fixed. Here it's more positive. In psychosis, rather negative, etc. There are many, many differences. But if you really think what it is similar to, I think it's with states described in Buddhist psychology, I would say. So in meditation, it's certainly an intentional state. You have a very clear end, beginning, like in meditation. It's very clear. That's a very big difference to cannabis, opiates, or you could induce a lot of mind-altering substances are around, but the specific here is LSD, psychedelic, LSD, MDMA, and psilocybin is that the state is extremely clear. That's positive for psychotherapy because this clarity, or like this refined, as my patient told, helps you to understand better your situation or your past. Certainly it's a non-doing, it's like in psychoanalysis, usually people, it's by the substance, they don't like to do something. And that can be very good because, for example, OCD, they have fear that the hand is dirty, and the exposure is you have this fear, but you don't wash the hand. And here's like a natural exposure. They fear of the dirt, but they don't have an impulse to do something. And that is therapeutic in itself because they experience that it's possible to have this dirty hand without washing and nothing really happens. So that's like, it's completely the model of behavioral therapy. It's non-judgmental. That's very interesting. People are more neutral, so they see it, they say, wow, wonderful glass, or they talk about themselves in a non-judgmental way, which is really very important, because otherwise, usually, even if they talk about their childhood, they would say, oh, no, my mother said always you're a bad person, or I don't know, very negative, but in reality, it's not true. That's more a judgment about their past. And on the psychedelics, they see it was more complex. They see how they interacted with their mother, and so it was way more complex than just to say, my mother rejected me. It's some kind of timelessness, some kind of sense of infinity. There's more spiritual things that are not so important in the kind of therapy we do. I will jump just that you see exposure therapy, I'm not aware of it, in psychotherapy, the most effective component is exposure. That's like you have fear of spiders, then you get exposed to the spider, or you had a trauma, war trauma, you get re-exposed to cues about the war. So that's the most effective thing. But there is that patients don't like it. So 90% of veterans reject this kind of treatment because indeed it induces anxiety and they have this fear of catastrophe. And I must say, with psychedelics, really amazing. You don't really expose them. You don't prepare an exposure. You don't need a spider or something. But the substance exposes them magically. I don't know why. It's usually they get an exposure. And the other thing, they never feel uncomfortable. So they have anxiety or they have negative emotions, but they're still always relaxed. So that's, I think, the most amazing thing as a psychotherapist. So I call this the Helioscope Effect because the sun would be the trauma or the death experience or whatever, and you can see into the sun. And then it looks different. It's this kind of filtering, you know. It's not really an opening of door of perception, I think. It's a completely wrong word. It's more what my patient said, this refinement, you know, you see more details, but at the same time, it's really filtered. And that's why they are still relaxed, talking about very negative experience in their lives. That's one thing, and certainly we do research on this. For example, we have a Helioscope questionnaire. Also, Vincent is doing discussion. Did you finish discussion? Yeah. Okay, so going to publish soon. But we love the questionnaire where we ask, for example, this session helped me to let go of difficult experiences or memories, or it helped me to accept them better, or during the session I could withstand traumatic, difficult memories, feelings or thoughts better than usual. This kind of thing. You know, this question is not specific for psychedelics. It can be used for meditation, can be used for CBT, classical psychotherapy, can be used for psychoanalysis, for whatever. But that's a bit my hypothesis, that psychedelics really help patients better to deal with this memory, and it's a real processing. So after, it's different than before. That's not always the case. Sometimes you talk about a difficult experience and that is not really leading to a processing, but it's more even after more negative than before. So it's a tricky issue how to deal with negative experiences. Another thing I want to mention, now we have 2 minutes. I think it's an important point. You know, we talk a lot about the stress system, usually in the public, psychiatry, stress-related disorders. That's true, for example, for anxiety disorders, for spider-phobia. But on the other hand, we have a lot to do with the reward system. You know, in depression, people are not just stressed, that would be like normal, but they lose interest in things. That's way more than being stressed, losing interest. We call it anhedonia. They don't feel pleasure, and that's a very serious symptom. I'm just telling you because the substance we have right now, so antidepressant, antipsychotics, they're quite good at reducing stress levels, but they're not very good at improving the reward system. So they're not really very effective against anhedonia, for example. And so it's just interesting that Albert Hofmann took LSD by chance, and he had a really bad trip. He had a near-death experience. But what is less known is that after this experience, he had a special state. He writes in his book, LSD Mein Sorgenkind, also in English available, exhausted, I fell asleep and woke up the next morning refreshed, even if physically still a little tired. A feeling of well-being and new life flowed through me. The breakfast tasted wonderful, an extraordinary treat. Later, when I stepped out into the garden where the sun was now shining after spring rain, everything glittered and shone in a fresh light. The world was recreated. All my senses vibrated in a state of supreme sensitivity. Certainly that has a spiritual aspect maybe to it, the reborn, but on a psychiatric more scale, I would say it's interesting that his sensitivity toward the positive increased, and I just feel that's amazing because our normal conventional therapeutic options are not really doing that. They are decreasing the sensitivity toward the negative, but not really to the positive. And that's a very interesting finding. You see also that's not just the breakfast, that's also nice that you enjoy your breakfast, but here that's the last slide I will show you. We started to treat, in the beginning, we just could treat cancer patients because this incurable disease in the Swiss law was first interpreted as cancer patient. And so we have a lot of experience. For example, Peter Gasser, one of the pioneers, but also treated some of these cancer patients. And for example, here is an example from Peter Gasser's work. The patient with the cancer asked, am I on the right track? That was my question, not the confrontation with death during the session, but whether I am on the right track. LSD intensively gave me the feeling that I was on the right track, that everything I was doing was actually good. So that's more of a positivity in sense of self-acceptance. And that's very important because also the patients I treat with cancer, it's interesting that the fear of death is not so strong as I thought. It's more the fear of doing the wrong thing or not, do I have to contact the friends or not? How do I deal with my children, etc. These kind of practical questions, and they are so glad if they see that, for example, here they do the right thing. So that's a positivity effect more than just enjoying the breakfast. So there are many, many more things to say, but you can read my book. I also have Tim Gabel. I don't know, this is an interesting person with a lot of followers. That was my most successful podcast ever. I think more than 100,000 people watched that. It's also TEDx Fribourg talk on the Helioscope Effect. So that's one thing. And finally, I want to make some advertising. I thought you're all so old today in Zurich, but you're not. Amazing. So, but still not the wrong slide, but we have a study on LSD and healthy aging. So most of you wouldn't really be fit for the study, but maybe you have grandparents or whatever. And we're also looking for interns, students who want to help with the LSD study. We're doing EEG, etc., with these elderly people. Most of the studies all done in young people, and we want to do now in the elderly because there is more of a problem of neuroplasticity. In your age, neuroplasticity is quite good, but if you get older, not in my age, but 10 years older, it starts to decline, and then you need some LSD. Okay, so you see also our labs, molecularpsychiatry.ch, and exactly we are still looking for students and elderly people. So thank you very much for your attention.
So there's still time for questions. So just raise your hands and we're going to come around.
Thank you for your wonderful lecture. I've got one. I'm here. What is your wish for the future for the scientific field of psychedelics in Switzerland? Since you published your book, there are over 2 years, and I'm telling you why I'm asking this question, because I'm also a physician. I'm a dermatologist, and I'm having almost everyday patient in my office with the problem of their self-esteem. They want to have Botox, they want to have laser treatments, they are not happy with their wrinkles in their face, and they are struggling all over every day in their life. That's my impression. Wouldn't it be an advantage for our society to open these psychedelics, on a safe field for more public people that are struggling in life, not only cancer patients?
Exactly. That's certainly a goal that now it's very restricted to this incurable disease. And this is more a legal issue, certainly. That's not important here. You could start, I would even start, why not, if a student is depressed, start with psilocybin, and then, if it's not working, give another substance. Certainly, thing is still costly, It would be costly. You have to evaluate. You see these 1,000, maybe many of your patients would then not qualify. So that's with the substance we have. Certainly in the future, they may be safer substance. I mean, it's sad to hear, but the term is now the non-psychedelic psychedelics. Maybe then the end, so that's why I like to give talks now, but maybe the romanticism will be gone in some years. But certainly if there would be a bit less psychedelic, the effects would be less, you could maybe do in your dermatology office or so. But certainly with the substance we have, it is difficult to go really, it's expensive and you exclude so many. I think the goal will, or the thing being to have other substances. For example, ketamine, very slow doses, may be an option. It's easier. People don't like it so much. I don't know. They like psychedelics. Certainly, psychedelics have an advantage. There's no addiction ever. With ketamine, it's possible. But I see it a bit in this direction. New substances that are easier to manage, to really go broad. Yeah. But it's so important not just to focus on psychedelics. I mean, you can also talk with the patient or do psychotherapy or...
I'm talking a lot with my patients.
I can imagine, yeah. Or why not do some Botox? I don't know. I mean, some people, there's studies on Botox and depression, where some people it helps with, maybe not with depression, but with regulating emotions or something. Yeah.
Thank you.
But it's a good point. I mean, certainly not, that's just a legal issue, that we're going with these severe patients. That's not a pharmacological or psychotherapeutic precondition.
So I think that it was mentioned firstly with LSD and MDMA, and afterwards it was mentioned that in the studies you started including psilocybin as a substance, and that now that psilocybin is like the most common one. I'm a bit interested to know why exactly like psilocybin was chosen as a better alternative to LSD and MDMA.
It's a good question. It's compared to LSD, it's shorter. LSD is really long, and it's the problem with workload and stuff. I mean, who is going to work from 8 in the morning to 8 in the night? That's gone. So, and psilocybin is shorter, 5 hours. So it's easy that you give it at 9, and then maybe at 3 or 4 you can finish the session. And it's also, if it's a bad trip or so, it's still a bit hard if you have 8 hours and hours. So it's easier to manage psilocybin, yeah. The other thing, certainly in the United States, LSD has a bad reputation. Not in Switzerland because it's a Swiss product. We love LSD. But in the United States, I mean, they have used it and made crazy things out of this nice Swiss little invention. And now they think psilocybin, it all relates more to their culture of maybe Mexico and the mushroom story. So it's also therapeutically, I'm not sure if that's really proven, but I think LSD has sometimes a problem. It makes people quite intellectual, so that we want these emotionalities sometimes less, mostly in young people. And psilocybin is like a bit softer, a bit more emotional. It's not really, it's hard to show that in studies, but most therapists would agree. But still, LSD can be extremely interesting, advanced therapy. In some people you see they need many hours to process, and then it's good you have LSD. It's still, I mean, Huxley, Leary, all these guys, at the end of their life, they took LSD. That's also interesting. They all switched to LSD finally. I mean, Huxley started with mescaline, but all end with LSD. So LSD is still magical. But for the treatment, for the practical issues, psilocybin is
Okay,
easy.
thank you.
I have one more question. I'm here to your right. What does the data say about microdosing? Because I read that it does actually increase neuroplasticity as well. But do you see clinical effects from microdosing as well? I mean, it would be nice because it's easier to implement in everyday life than a full trip.
Exactly. So far, what we know, it is not really effective. There's just some weeks ago published a big study from Basel in ADHD. I mean, microdosing, and it was clearly not effective at all. So there's a lot of placebo effects. We have also the COMPASS trial with 1, 10, and 25 milligrams, and only 25 milligram was effective. So far, it's really the high dose that we have evidence that this has an antidepressant property. So psychedelics, there's certainly, one thing is also the safety, the pharmacological safety. I said it's very safe. It's not really true if you take it daily. So headache medication, they were really similar to LSD, and they gave it over long term. And really, they had a very high rate, up to 30% had cardiac valve problems. So that would be another issue to see if you take it daily. It's safe, one for driving a car, but also because it's a growth substance, not just in the brain, but all over the body. Then you get this fibrosis, for example, in ketamine in the bladder, in psilocybin-like substance in the heart. So that's another issue. But certainly, there will be new substances, there will be new trials, but so far, as I see, there's not a lot of evidence for microdosing. If you really take the placebo, there's a lot of placebo effect, which in itself may be a good thing. I mean, you're not in a study. If you're in real life and you think you believe in it and you take it and you're doing better, then why not? But I don't see. But I must say there's also not so many studies on this. So there's certainly more research needed.
Hello. I would have two questions. One, the topic of historical background of research of psychedelics in Switzerland. I think that's quite unique. Is there any good literature on that topic available or easy to find?
On the Swiss tradition,
Yeah.
That's a good thing. I mean, we just conducted a study where we asked, I asked all the old guys who did that. They had a license, can you imagine? They had a license. They didn't have to ask anyone. They had a license. They combine and everything. And I interviewed all of them that I could find. And it was very interesting. So I learned how to do it. And we recently did a study where we asked all the therapists in Switzerland at least how they do it, what kind of patients, what doses. Exactly, we do this kind of field research. But really the history, that's an interesting thing. Because it was also in Zurich. It's very interesting that Hoffmann had a supervisor, and the son of the supervisor became psychiatrist in Zurich, and he conducted the first trial. I'm sure there's a book, certainly on Albert Hoffmann's life is a book, that's certainly interesting. Yeah, certainly this book, LSD Mein Sorgenkind, that's certainly a good book where you can read how it started. You will see that's certainly a book. The other thing is with the treatment that started in the 85 or something. I doubt that there's a book, but there certainly is a book about the discovery, LSD, and the early trials on this early research in Switzerland. Okay, but the unique thing is this treatment. I don't know if there's a book, but that's interesting.
And second question, what about DMT and research into DMT in therapeutical context?
Yeah, that's big. So I'm putting all my money on DMT. No, that's big because if you give DMT, it's not working because it's so short-lived. And I mean, Rick Strassman, a great psychiatrist, he did that a lot, and he said to me, and he said also openly, that's not working. But the new thing is you can do infusion. You know, you give an infusion, then you're going to go up at DMT, and then you can see how it works. It could go up and down. And I think in these neurology patients, so we're planning a study. We get already 120,000 from a foundation to do DMT research in patients. And for example, these because then you can better try it for about some minutes, you can stop it, etc. But it's even more costly. DMT is horribly expensive. And then it's not so romantic. You need an infusion, but in this neurology clinic, that's not an issue. But that's a bit the thing. So it's more medical, you know, where you go up and down. But still, I think there is a huge future I see for DMT.
Up here?
Yeah.
About the dosage of, for example, LSD and the other substances. Why is it that you choose 100 micrograms to 200 micrograms? What would be the side effect if you go higher in the dosage?
So it's microgram. You have to understand, LSD, it's magical because it's microgram. You can imagine all our substances are milligram, you know, but it's microgram. But you see it here, for example, here you give 100 and 200 microgram. I don't know if this is really saying micro, but I know it's a microgram. And you see the positive effect. So you ask the patient, it's positive. That meaning is he relaxed all together. And the negative, it's rather they're tense or they're nausea or the headache. And that's not good for treatment, because if a headache, you cannot do treatment. So that's a myth that should be positive. And you see, then there's an optimum where you have the ratio between positive and negative is the best at 100 microgram. If you go lower, the positive effects goes dramatically down, but if you go higher, then the negative effects go up. It's so possible that that's only the first time. Certainly if you treat the patient over time, they get more and more experience, and then you can go up with the substance because they're used, or you already know headache is a problem, you can give a substance, and so they get experience, and then you can do higher doses. But that would be really the rationale for doing the 100, not the 200.
And how is that with body weight? Is that in comparison to body weight, or is that just in general?
No, it's interesting. In the whole pharmacology field, we don't do body weight. It's interesting. I mean, we always look at body weight, but it's always not related to body weight. We don't know exactly why that is, by the way, but it's not body weight related. Here also, I must say, psychedelics is very specific that, I mean, usually if you only with lithium, you measure in the blood and the brain, you have the same concentration, but otherwise it's chaotic. The blood concentration is not related to the brain concentration. But here with psychedelics, it's a high correlation. So if you measure in the blood, it's highly correlated what they feel, so the intensity of the substance. That's very interesting. That's also unique to this substance, because otherwise we wouldn't see that. If you give an antidepressant and you ask how it works, the relation is minor with blood concentration. Yeah.
Thank you very much.
Okay, one last question, and then.
Thank you for the nice lecture, firstly. And I was wondering if you could elaborate a bit more about the effect of psychedelics to the human ego and the effect in...
Exactly, that's the slides I skipped. But you can see here, I mean, one thing I'm using, I mean, first you have to understand the self. I mean, self-psychology is quite a mess, so there's no really clear what the self is, I must say. There's a handbook of the self, 1,000 pages. I read 1,000 pages, and at the end I didn't know much more than in the beginning. But anyway, self is difficult, but you can still say there is one narrative self, that the stories you think, you know, like people say, I'm thinking too much, and what they think, they judge or they think something. And the other, we could rather say the minimal self, that what Buddhists aim at, so that you have really this bodily sense, very direct experiences. And you can say psychedelics move you from the narrative self to the minimal self, where we really experience, like even with memory, it's not that you say, my mother always rejected me, but you experience like an interaction. Something's crazy, the patient is the mother, you know, speaking to her child. And that's this narrative, this judgment go away. And usually I think it's a lot of narration in ourselves. When you ask, what are you doing now, right now? What is your consciousness? It would be a lot, I'm thinking about something, and not I'm sensing something. So you go more into this sensor mode of the self, I would say. And that's therapeutically important. The other thing, the self is not so strict, so that's why you're not so easily traumatized. You can say, wow, they will das and I have this pain, because the self is more looser or so, or you observe your own self. That's maybe part of this Helioscope effect.
And is this effect also after the trip ended, or is it only during the trip, this feeling of being more in the minimal self than?
No, something amazing. For example, patients who think all the time, you give them some MDMA, and then it kicks in, and then they are not thinking anymore, and they're the best patients, and when it stops, they start again to think. But there are some long-lasting effects. In some patients, also shown in studies, it's still turning you. It's certainly motivating you. You know, one thing, it's a lot of motivation. You see how nice it is not to think and to sense. And sometimes they're like motivated to do meditation or anything to learn this in daily practice. But there's a little bit of lasting effect. So the amazing effect goes away after these hours.
Well, thank you, and give another round of warm applause for Professor Hasler.